And here we are again with another session of Q&A with Barbara. If you'd like to lead off with the first question.
Yes, my pleasure. Our first question is from Emma. She's 54 years old and wants to know what derma fillers help address sunken cheeks and eyes.
54, sunken cheek and eyes. So usually at that age you are losing volume, and the areas commonly are the mid-face, so sunken cheeks is really part of that. And you said, what was the other thing with the eyes?
Derma fillers address sunken cheeks and eyes.
And eyes. So you start to see some hollowing out or tear trough deformity or tear trough volume loss, again, as part of that aging process. And this is typically in the mid-face where it starts. So we approach that with fillers. Again, I always say use small amounts, build up slowly, you get a lovely result. And alongside that, we're using the new regenerative biostimulator fillers as well. Sometimes they're combined with a filler, such as Harmonica, or they may just be on their own, such as Structura. And, you know, we are using polynucleotides as well for the skin. So there's a combination approach to restoration there of volume. And more importantly, do remember it's not just about volume, it's really about lift, because a lot of the tissues, whilst they've lost the volume in the fat compartments, they've actually descended, and they give rise to this sort of sagginess, which gives you your typical jowls and double chins. So if you're starting to address these issues here, you should be addressing them by treatment up here to give the lift. Okay.
Oh, that's very nice. Okay, our next question. We seem to be getting a lot of questions from a younger audience who have never had any treatments, and they're doing their research, which is great, but sometimes they don't understand certain terms, which is why I included Rose's question. She wants to know the difference between a cannula versus needle technique.
I suppose if you're not medical, you wouldn't necessarily know the difference. We use both. I use both. They're used in different ways for different treatment styles, if you like. The cannula is basically a blunt, long needle, so it doesn't have a sharp point, and it's introduced in through the skin by making a hole with a small needle. And by using the cannula, number one, it's very safe because it's unlikely to pierce any arteries or damage any nerves, providing the cannula itself is not too thin. And then you're able to place products in areas that the needle would be more difficult to do. So that if you really want to use filler to spread it around, then the cannula is an ideal tool for that. And again, if you're working in areas where there's arteries and there are danger zones, then a cannula is a useful tool to avoid those structures. The needle is still very useful because we're using that for more precise injections. So if we're looking to place small amounts or depot amounts of filler underneath the muscle to give lift, then we're going to use typically a needle most of the time. And obviously when we're using the needle for Botox, you can't put that in using a cannula because again, you're targeting very precisely the muscles, and the cannula is not appropriate for that. So that's the difference between them. It's from a technical point of view, there's a reason why we've got both of those.
Oh, beautifully answered. Okay, Bella is our next question. Bella is 59 years old and says she avoids smiling in photos. we get a lot of this question. The wrinkles around her eyes when she's smiling looks hideous. What procedure do you recommend?
So when you have wrinkles or crow's feet around the eyes, usually that's, that you start getting those from the 30s onwards. And at that stage, we would use Botox to prevent wrinkle formation and treat those crow's feet. As we get older, there are other things going on which will make those wrinkles more obvious and less responsive to Botox. The muscles themselves become weaker. So in fact, more wrinkles, more Botox that's not the way it works. So you have to look at other things. So you're looking to strengthen the skin itself. And I've mentioned polynucleotides before as a possible way of doing that. You're using very light fillers to address those wrinkles. There are different techniques. There are different reasons for doing them to provide strength in the skin layer itself. And not that I do it, but there are things like lasers as well, which do skin tightening. So there's a lot of options around, but like most things, a good, careful assessment for that individual with an explanation of the pros and the cons and suitability and costs. That's very key of the consultation process.
Okay, that's it.
That's it. So that's all for today. Please keep coming to my website and submitting any questions through that. Thank you.